I want to start our second technical session, that is on human security, health and governance. Chairperson is Dr. Biswajit Mohapatra, who is Associate Professor, North Eastern Hill University, Meghalaya, India. And co-chairperson is Dr. Raymond, who is Assistant Professor at Department of Political Science and Sociology, North South University, Bangladesh. Over to you, sir. I already made you co-host both Raymond and Biswajit Mohapatra, so you can unmute yourself whenever you want. Sir, we can't hear you. Raymond, are you there?
Hey, hello.
Hi. Yeah, you can start the session. I think Biswajit Mohapatra is having
some... now I become muted.
Hey,
yeah,
hello.
Now I'm unmute. Yeah, right. I think, can I start?
Yes, yes.
Yeah, I think at the outset, we must thank Dr. Nandini Vasista, who has taken great pains to organize seminars. We all understand that it's not an easy thing where seminars can be held so easily. And then also because of the fact that it is being held at the right time. And when the COVID is almost on the wane, we all know that the COVID had probably put the whole world order into disorder. Raymond is there on the other side. He would probably add his own thought, but I find that when the disorder has been very much there due to health reasons and also spread of the Wuhan virus, this is the right time where we can discuss about the health. Health has become an important issue of human security, which is called upon each one of us to pay more attention to research oriented on human health, rather, and also added to it the health of the planet that we are living in, which can only help in the survival of the human race than anything else. I think we all thought that material progress is everything which will help the survival of human race, but then we found that material progress doesn't stand anywhere when the health of the human beings and also health of the planet is in great danger. And when both the humans and the planet are in great danger, it tends to present a scenario which is not only grim, which also calls for some bit of a hope in our own search for solutions, where we can ensure that we live as very, very civilized human beings, which is what we claim. With these few words, I welcome the paper presenters who are present here, and also welcome Dr. Raymond Kwun-Sun to say a few words before we get into the formal session. Raymond, can you speak something? Raymond?
Hey, hello.
Hello.
Doctor.
Can you speak for 2 minutes, please? Yes.
Yeah, so good to see you. Good to see you. And first of all, I would like to take this opportunity to say thanks to Dr. Nandini Vasista for her very kind invitation to co-chair this very important panel section, okay, which is the papers presented okay, in this panel are closely related okay, to human security, health, and governance. Okay, and just like Professor Mohapatra rightly suggests, so definitely this is a good time okay, for us to sit together, brainstorming together on this very timely important issue relating okay, to human security and the health okay, in this context of this ongoing COVID-19 pandemic. So I look forward okay, to learning from the insightful analysis from the presenters in this panel. Thank you.
All right, most welcome. I think we will start one by one. And since there are 8 paper, there are almost 9 paper presenters who will be presenting their ideas on this session. And at first, we'll welcome Sudhir Charan Jena, who is a retired professor in BJB College, Bhubaneshwar. Professor Jena, are you online, sir? Professor Jena?
Yes, sir. He's online.
Yes, sir. Yes, sir.
Right. Right.
Yes, yes.
Sir, you start your presentation. Kindly start your presentation, sir.
Yes, yes, yes. Yes, sir. From audible? Sir, are you audible?
Yeah, you are audible.
Hello.
Slightly some network problem.
Okay, sir.
but
Thank
good.
you.
Yeah.
Okay, okay. Thank you, Professor Biswajit, Raymond. Thank you, Nandini, madam. So, sir, time is 5 minutes or 7 minutes?
I think
Sir,
we'll take
time-
5 minutes, 2 minutes extra. If it's required, we'll take 2 minutes extra.
Okay, okay. Thank you, sir. Thank you, sir. Sir, good afternoon to all of you. In India, we have experience of governance. In the morning session, we came to know by way of our discussion that governance is in no way a concomitant of democracy. We have elected democracy in India, which is neither participatory. Democracy is intact, but instead it is moth in or a great hollow, says Vajpayee, ex-Prime Minister of India. If governance means what government does, then we can emphatically say that in health sector, we are not up to the expectations of people. Human security is comprehensive in nature. Mere physical security from outside force is not everything. In the inaugural session, as well as in the morning session, we heard of human security as human right, which includes freedom of fear, war, and integrity. We also heard of minority security along with security of community vis-a-vis national integration. But my study is on health security. To me, health does not mean mere absence of disease or infirmity. It has been considered as a fundamental human right, indispensable for the exercise of other human rights. The title of deliberation, Health Hazards, a man-made threat to human security, implies that failure of governance as well as we people are responsible for health hazards of present day. To me, it is man-made because health policy in India is not implemented with the intention to achieve the target. We are successful in our attempt in eradicating polio and fighting against COVID-19 to some extent, but we fail in checking infant mortality rate, malnutrition, anemic women in rural as well as in tribal zones, side effects of liquor and tobacco on personal health as well as on the health of the family, impact of special economic zone on human health and habitats, effects of pollution, disaster caused by greenhouse gas, and emotional as well as physical problems caused by e-administration itself. So key issues that should guide any health policy initiatives in India are to make people aware of healthy life, voluntary bodies, particularly community-based organizations, to take the initiative, services to be provided on PPP mode, public-private participation mode, focus to be laid on indigenous way of life. Investment at grassroots level is essential. In any health policy, tribals should get the top priority in India. To conclude, a rethinking is highly necessary, both at government and non-government levels, to ensure health security as it is the forerunner of human security. Thanking you.
Professor Jena, I think some very, very important points have been made in your presentations, although they were very short, but I could understand that
It is a
your
long
paper
paper,
tends to
sir.
point out
It is a long paper, so already the complete
no
paper,
problem.
full paper has been given. Okay, sir.
Okay, no, understood. I'm not criticizing your paper. I'm just saying that in your short presentations, you have made very, very valid points where you have pointed out to the failure of governance, which is what is probably not only a third world phenomenon, it is also a kind of advanced countries phenomenon. We now know that how the globalization tends to have also proved the inadequacy of the Eurocentric state system, which calls for rethinking of governance at all levels, including in the sector of health. The other important point that I find is that probably you have outlined the role of community health organizations, which is what we'll see how the other paper presenters tend to respond. My idea of summarizing your presentation is for the other succeeding paper presenters, the other paper presenters who are coming up with ideas, to also reflect upon certain issues which have been voiced by you and by the other thinkers, and also probably sort of inform the house present today as to how each one of us has to go about doing our things as far as ensuring human security in general is concerned. Thank you. Thank you very much.
Okay, sir. Thank you.
Yeah. Can I? Thank you. Thank you very much. Dr. Raymond, do you have to say something on the paper? Dr. Raymond? Dr.
Yes,
Raymond?
yes. Can you hear me?
Can we? Yeah,
Yes.
please.
So once again, thank you very much, Professor Jena, for giving us this very timely and important analysis of this health the paper entitled, which is entitled "Health Crisis: a Man-Made Threat." So I think against this backdrop, it is ongoing in the context of the ongoing pandemic. Nothing is more important, right, than having our awareness being raised, right, on this issue, of health security, because as we can see, health problems like the COVID-19 in this scale, okay, can potentially constitute a threat to the human security, because they can result in a large number of deaths, and that can also inflict serious damage worldwide. And so I think I've learned a lot from Professor Jena's presentation. I look forward, okay, to continue this dialogue with you. Thank you.
Thank you. Thank you, Dr. Raymond. Can we invite the next paper presenter, Dr. Babulal Devanda, who is serving as the head of the department in the Department of Political Science, Agarwal PG College, Jaipur, Rajasthan. Dr. Babulal, please.
I think Babulal is not present here.
Okay. Okay, then we go to the next paper presenter. We have Rushiraj Upadhyay. Are you here, Rushiraj? Rushiraj, are you here?
No, I think Rushiraj is also not here.
The fourth.
Okay. Can we have Dr. Archana Anand, please? Are you present, ma'am? Dr. Archana Anand?
Visible strategies to direct activities of the health sector. Like in the United States, the health people offer a simple but powerful idea by providing health objectives in a format that enables the diverse group of combine their effects and work as a team. Similarly, in India, we need to roadmap to better health for all that can be used by states, communities, professional organizations, and all sectors. It will also facilitate changes in resource allocation for public health interventions and a platform for concert. Professional or sectors. Scope for further action in the health sector: school health, mental health referral system, and urban health remain as weak links in India's health system. Despite featuring in a national health policy, school health program have become almost defunded because of administrative, managerial, and logistic problem. Mental health has remained inclusive even after implementing the national mental health program. Remained. On a positive note, innovative schemes through public-private partnerships are being tried in various parts of country in promoting referrals. अभी तो role of government in enable internet. अरे अभी तो बहुत सारा है बेटा.
Ma'am, have you finished? Archana, ma'am.
मेरा नाम आ गया.
Ma'am, have you finished?
आप पीपीटी को वो तो करो. ज्वाइन नहीं करना, अभी तो आप करो भी, नाम नहीं बोल रही अभी तो.
Ma'am, I think Archana ma'am already finished. We can go for the next one. Sir, I think Ma'am, have you finished?
Yes.
Okay, then thank you. Biswajit sir, we can go for the next presentation, I think. Sir,
Okay,
you are...
so we are going to have the sixth speaker, Kumari Priyanka, who is an assistant professor from Jaipur Workers College, Hakan. So the paper that Kumari is presenting is entitled "The Echo Chamber of COVID Threat: Mental Insurgency in the Post-Truth Era." So over to you. The floor is yours. Kumari, Priyanka. So, are you here? Kumari,
Yes, Kumari Priyanka, you are already unmuted. So
thank you, ma'am. I just saw it now. I was in mute, so I just saw it now, ma'am. I'll be presenting my paper.
Yes, please go ahead, please.
Sir, I'll just continue with the paper. As sir has already announced my topic, and now I'll just read out my paper for everyone. Sorry, I'm not able to make a presentation, but I'll read my paper for everybody. This pandemic, as we know, has exposed the worst issues lurching at the core of our civil societies. It's a stark reminder of everything that can actually go wrong and that has gone wrong. And especially when you are in a developing country, these things become multifold because you are at the receiving end of so many problems from so many issues that it kind of forces you to think really that, how it is affecting the mental health of people, and especially when they are captured in a chamber where they're just receiving the news of pandemic without any end in sight. So my paper is based on that. That how COVID actually became an echo chamber at the end of the day, and how we kept on listening to news, articles, even WhatsApp forwards, social media articles that disturbed our mental health, and the recorded mental health issues are really something to think about. COVID-19 is a stark reminder that humans have very little autonomy. One would arrogantly think that this is to the very least applicable to our bodies. But the matter of fact here is a pandemic like COVID-19 forces us to reimagine our constructed belief systems. In fact, every once in a while, as we say, in the turn of a century, we are meant to shift our perspective of what happens around us. We were forced to shift our mentality about the global connectivity and so many other things. This reimagination is multidimensional, and in the case of COVID-19, it affected the way we travel, work, study, or live our basic life. The new normal, the very important word here, the new normal was reconstruction of realities that we had taken for granted. Take, for instance, wearing a mask and using a sanitizer have become a very normal thing. For people who experience the lockdown, it is also a reimagination of lifestyles. The impact of COVID-19 has been all encompassing, and it has startled all sectors. And when the world settled down a little bit after the first and the second wave, we were a slightly changed species in the way we think. A generation that witnessed a lockdown, a generation that lived through the boons and banes of global connectivity. There is a recorded evidence of the pandemic, and mankind has witnessed such incidents as second-hand information. But this pandemic and its magnitude has left an indelible personal mark in all our lives. The keywords here are pandemic, pre-pandemic, the things that we need to think that earlier to this, we only knew the word pandemic at this large scale only through the historical examples of the plague, maybe the London plague, etc. But this pandemic made it our reality, and it is there to stay, at least in our heads, the generation that went through this. Okay. Even though now the COVID pandemic has subsided, we can safely earmark two worlds, the pre-pandemic era and the post-pandemic era. It is indeed an observation in spheres of science, psychology, and other domains to see how our lives were impacted and molded. Pestilence, plague, and diseases are much dreaded birds that can wreak havoc on humans and sometimes wipe off a significant percentage of population. Indeed, references from Oedipus Rex rekindle into the mind how the public pleaded to the king, how they prayed that they may be saved from the clutches of the unknown. COVID-19 has been a very similar nightmare for so many of us, where we were looking at our administrators to save us, where we were looking at the government to save us. And when you cannot do anything, everything is beyond your power, that helplessness really, really captures you in a mental chamber. That is something we need to really, really think. It is indeed ironic that in the beginning, the COVID-19 infection was treated as a joke. In fact, if we notice that, there were so many memes on internet, and there were so many funny things going on about, how it's just a virus and people are overreacting. But then after some time, it really, really became the joke kind of turned back on us, and we used to say very lightly, you will catch the COVID infection. And now it seems like a dystopian reality. That is really something, which is disturbing at at multiple levels. The death toll has been unprecedented and beyond our scariest dream. In India, we saw the impact of second wave and how it devastated and brought the nation to its knees. A complete standstill, we may say. COVID-19 started as a mere threat in a foreign land. For us, it was something which was happening in Wuhan. And then again, like I said, it became our reality, and slowly and steadily, it took over the entire nation, especially during the second wave. And when we talk about the impact of the lockdown, it has engulfed our personal lives, and the lines between the personal freedom and safety of all became a reign of contention, meaning we had no personal liberty. We had to be on the mercy of others. And this is something which really played with our mental health. This sudden snatching away of personal freedom has impacted the human minds and made us question our own sense of autonomy and freedom. In a sense, it raises a question: are we really sovereign, autonomous bodies? The myth has all but been shattered to pieces. The social relationship and common entertainment was also compromised and had a very drastic effect on the overall mental health of all the people around the world. While the dominant discussion on COVID-19 has always been about the physical health, obviously, like immunity, etc., we all miss out on the aspect of mental health. The pandemic has wreaked havoc on people, and it has triggered so many underlying threats, underlying anxieties that we had. And not just that, the isolation, the unemployment, being in a room for so long, all of this kind of really impacted the mental health. And if we look at these statistics, the rise of the rising domestic violence cases, and even children were mistreated during the COVID. Many children picked up the phone, lodged complaints against their own parents that they were mistreated in their homes, and all sorts of violence. We saw the rising violence. In fact, there is an elaborate research going on post-19 stress disorder. Even though there have been worst pandemic, this pandemic had more mental impact due to news and internet. People could never disengage themselves from the constant barrage of information. That is, like I said in my abstract, that is what I'm calling the echo chamber, that even if I would want to disconnect, I was never allowed to disconnect, and that is something which was really devastating for so many of us. And there are so many other statistics available on that, and the age group that was most affected was from 18 to 24. They were feeling as if they're losing out on life, they're losing out on their youth. Sir, do I have 1 more minute? I'll wrap up according to the time I have left.
Please complete in 1 more minute. Yes,
Okay,
1 more minute, please complete.
So then I'll just put Okay. Like I said, and the psychological effect that it caused is something to think about, especially the most affected age group is 19 to 24. And the another aspect that we really talk about is the rising suicides in so many people, be it due to the real threat of COVID or due to the imagined threat of COVID. The second wave of COVID left a void that can never be filled. Once we realize the lives that had been lost, it takes us a step ahead into understanding how many other sectors need to be examined, restricted, and if anything, held accountable. The medical malpractices, mismanagement of resources, and misinformation created a very complex reality that was hard to digest. The applications reported death toll country-wise. I'm talking about the COVID applications that were available on internet, and it is somewhat dystopian when humans become statistics so quickly. As working professionals, people lost their jobs, and the ones who were employed were forced to work even after losing family members. You know, somebody is dying and you're still working. That has to be something for your mental health. In colleges, for example, despite losing family or being affected themselves, the academic and other activities carried on. The psychological impact of such enforced normalcy and neutrality is yet to be fully seen in the population, unfortunately. And the most important point and my concluding point would be that it was a shift, especially the second wave in our country, from a public tragedy to a private tragedy. For a very long time, we were just looking at statistics on television, and it was still okay till somebody else was passing away. But when it became a private tragedy and it became a very significant thing in our lives, the first wave for many was a spectacular tragedy, and the pain of loss and otherwise discomfort was still secondhand. The second wave was very personal, and it was impossible to ignore or remain unaffected. It posed a significant existential threat on people, and it would not wrong to say that it left a nihilistic aftertaste for so many of us, that the rising nihilism in so many of us. And there were so many people, you know, there are recorded cases of mental health. If you look into it, due to the paucity of time, I'll stop here, and thank you very much for giving me this opportunity.
Raymond, can you say something, please? Raymond, since you had called up the name. Raymond?
Sir, just
Yes,
one
yes,
request,
Raymond?
try to conclude the session by 5.
Sure, 100%. Do it. Yes, Dr. Raymond, please.
Yes. So thank you very much. Yeah, Doctor.
Priyanka, Dr.
Priyanka.
Yeah, Priyanka. Yeah, for giving us this very important analysis, especially this mental health aspect. The impact of the mental health, the impact of the COVID-19 on the mental health of people. Right? As I think what I found is very impressive with your paper is what you have suggested, the reconstruction of reality, and also the kind of new normal that people are currently experiencing. And so definitely, I think this is a very important contribution that your paper has made to this panel. And thank you very much once again for your insightful analysis. Thank you.
Yeah, I think Kumari Priyanka, your paper was significant in the sense that you probably mean when you talk new normal as not only physical but also mental. I think, the mental health issues which were otherwise in the background have now come onto prominence, and people are probably, when I go around the cities and places, and I find that people are probably feeling more mentally sick than what they are physically are. I think somewhere that, probably it calls for the integration of both mental and physical health conditions where human beings could live prosperously well. Thank you so much. Thank you for having outlined a very good problem. Thank you very much. Dr. Raymond, can you call the next name, please? Dr. Raymond, can you call the next name, please?
I
Can
think
we
Sir
have
Raymond is
Dr.
not
Raj
here.
Kumar?
I am just reading the next
Yeah,
name.
can I talk?
Yeah.
Yes.
It's Dr. Rajkumari Meena, Research Scholar, Department of Psychology, University of Delhi. Her paper is on mental health, security and governance in elderly population of India.
Right. Dr. Meena, please, can you come online? Dr. Meena, can you hear us? Dr. Meena, I think if she comes late, then we'll
Yes,
again accommodate her.
Rajkumari, please.
We go to the next.
Can I present within 20 minutes, please, if you don't mind?
Yes,
Next.
yes.
5 minutes.
Yeah, sure.
ma'am.
Thank you. Yeah, sure. Thank you.
Okay, so Rajkumari, don't you want now present?
Ma'am, within 15 to 20 minutes, please.
Okay, then
Yeah.
we can
Ma'am,
call our next presenter.
Yeah. 5 p.m.
Yeah, we
At
could.
5 p.m.
Okay, no
5 p.m. ma'am,
issue.
session will come to a close.
Oh, so before that.
Can we?
Okay, no issue. We can call the
Yeah,
next
ma'am, okay.
presenter, who is Basit Javed Quraisi, research scholar, University of Kashmir. His paper title is Academic Stress in Emotional Intelligence and Mental Health in relation to scholastic achievements among medical and engineering students and governmental response.
Basit? Basit, are you here? Basit? Basit?
Yes, but I
Do we
can
see
see.
Basit here online?
Yes, yes. Basit, you are co-host now. So
Okay,
you
ma'am.
can share your screen also if you want.
Okay, thank you, ma'am. Good afternoon, everyone. I'm Basit, as ma'am already said. I'm a research scholar from University of Kashmir, and I'm presenting a paper on academic stress, emotional intelligence, mental health, and in relation to scholastic achievement among medical and engineering students and governmental response. It is a world, today's world, it's a very much competitive world where every student face various academic problems. And those students who are in medical and engineering college, they also face academic problems that include that they have the exam stress, they have the disinterest in attending the classes, or they have the inability to understand the subject. Academic stress has been identified as a detrimental issue across various countries, culture, and ethnic groups. The increase in stress, it has given rise to various mental health concerns, where these students report increased anxiety, they report depression, and even in some students, there are the suicidal ideations as well. So there is a certain level of academic stress that is known to push the students toward performing well, as that stress is known as eustress, or we can say that is a good stress that helps student to perform well. But if this stress is not managed well, or it exceeds to the maximum level, it can have a direct consequences for the student, and not only for the student, it can have a direct consequences on the institution as well, because without students, institution are of no use. So at medical and engineering college, there is a wide range of academic pressure field. And why this academic pressure field is because it has been derived from the need of perfection. Because we see that in this world, we want the doctors and engineers to be very perfect in their profession. If they make a mistake, we are not going to accept that, and they have to be the very much perfect. So they do have to worry over the grades, and in some there is a parental pressure for such degrees, and there is a competition as well. So the academic stress will directly have the impact on the scholastic achievement of the students like engineering and medical students. And there is a strong relationship between the emotional intelligence with anxiety and the stress. There should be a strong discussion on what happens to emotional intelligence when there is increase in academic stress among professional students. The situation caused by academic stress and its impact on medical and engineering students, it is alarming. And now it is the high time to stream the governmental policies and the strategies regarding them. While going through the data and while going through many studies, I found that scholarly pressure, it is a well-known mental expression that clinical understudies or the clinical students inside during their preparation period. The scholastic pressure, it was viewed as a gentle, moderate, and serious. And it has been found that 17% of the medical students, they have the gentle scholastic pressure, whereas 7.3%, that is the majority of the students, have the moderate scholastic pressure, and 5.2 have serious pressure. So scholastic pressure is a typical finding among the understudies, but the adaptive style to manage this stress, that was found good in the couple of the students, and that was not good in everyone. So the poor mental health was found in the clinical students of Nepal as well. And the commonest rate were that 29.2% were discouraged in their studies, 22.4% were having medium to exceptional serious substantial side effects, where 44.1% they were having the frenzy condition, 5.8% were having the other attention disorders, 5% were having the voraciously consuming food items, and 1.2% were having bulimia nervosa, that is a eating disorder. 4.7% generally consider ending it all with the clinical school, and 9.9% considered exiting the clinic school within the previous month. Around 15% of the understudies revealed utilizing of weed during the clinical schools and other drugs that should not be neglected because they are the future doctors, and this should not be neglected in any condition. So academic stress in students is most influenced by the nature of streams they choose, by the nature of the universities, by the atmosphere of the university. The level of stress, anxiety, and depression, it was high among the engineering students as well as in the medical students, and it was significantly higher for the female students. But in few studies, it has been found that this was the equal among both genders, male as well as female. Whereas many medical students reported they use sedatives more than once a week, because the academic stress, it not only affects the mental health or emotional intelligence, it also affects the sleep. And when the sleep is disturbed, the overall body of a person is disturbed. So they have been using the sedatives once a week. However, no negative relationship was found between emotional social intelligence and academic stress in MBBS students. Now, let's talk about our own education structure, our Indian education structure. It is our education system, it is known for the value system, and it is congratulated its unity and the holy duties. So, but the educational structure in India, it is a workbook equivalent structure where we majorly focus on the swat up or cramming of the assignment, which requires studying for hours and regular studies. And this complex schedule of studying from dawn to dusk leaves no compass for socialization and recreation. And this is the college life. The medical students starting their graduation, MBBS or any BTech degree, this is their college life. And the college life is considered to be the topmost stage of everybody's life, where we enjoy our life, where we make friends, and we all need that in our life. But due to the pressure, due to the academic stress, these things have been, these students are deprived of these things. Besides this, it is a period of perceiving knowledge as well, and taking new methods that helps us to stand up on our own basis. In the present period, scholars are passing a cutthroat competition among them. So stress seems veritably common in council scholars' life, especially scholars in the professional degrees. College scholars, it is a group that is prone to academic stress because of the changing nature of the college life, as well as the maintaining higher position of academics. Academic stress has been reported to be most internal state that medical scholars witness during their training period. It is on rise among them, presumably due to the course conditions. The issue brought out related to academic stress were inordinate
I think you
assignments.
have 1 more minute.
Okay, ma'am. peer competition, examination, and problems that are related to time operation, inadequate resources, as well as a semester pattern for performing academic work. As I don't have much time, so let me conclude my paper. So my paper, it reflects the important insight into the nature of the stress faced by medical and engineering students and the way they deal with the same. Therefore, they need to be educated regarding the healthy coping methods, counseling session, and other student support system needs to be more organized to cater to the issue like career guidance, healthy coping behavior, time management, and to improve the self-esteem among the affected. Attention should also be paid to make the student environment in the classroom more stress-free without excessive academic load, educating students about unpleasant consequences of stress and equally important. So teacher can also play a constructive role in mentoring and guiding students regarding choosing the right measures to cope with stress. Interactive academic session on stress control can further encourage students to
Ma'am, will you
single out.
conclude it, please? Ma'am,
Yes, sir.
ma'am, can you conclude?
Yes, sir, I'm concluding the.
Okay.
The aim of reducing the academic stress, adapting healthy academic stress coping behavior, improving academic performance, and minimizing anxiety among those with forethoughts about the future professional career. So this was my paper. Thank you.
Thank you, ma'am. I think there was a shortage of time. There are two more presenters there, so I had to interrupt you. But nonetheless, I could see that the kind of survey that you undertook, I mean, you also talked of Nepal students. I mean, what was the sample size? How many students did you interview?
So it was about 500 students.
Okay, and then did you have any specific finding with regard to girl students during the interview? Was there any specific point that you found with regard to girl students, or is the study limited to boys only?
No, it was equally distributed. That sample was equally distributed among the boys and the girls. And in the Nepal, it was found that the girls in the medical stream, they are highly significant. They have the higher academic stress rather than boys.
All right. Thank you very much. I think we'll have a little better time to discuss about the issue. But nonetheless, I appreciate your paper that you are talking of a very, very specific professional section of the students who have to take the leadership of the country, both in the technical sense and in the general sense. And I hope that your paper will help us to understand their situation of stress and also probably work out a better finding. Thank you very much. I think now I'll call Dr. Meena, if you are here. Dr. Meena? Dr. Meena, can you have 5 minutes to speak, please?
Yes, sure. Good evening, respected sir and ma'am. Good evening, everyone. My topic is mental health, security, and governance in elderly population of India. The UN classification, a nation is aging when the proportion of persons over 60 years across 70% health cross the transition faster than other country in the world. Mental health and well-being are more important in old age. Mental health disorder among elderly population are major part of total disability. Excuse me. India designated as a shining nation by United Nations due to rapidly rise in the elderly sub.
Meena, you can take some water.
Yeah, no, ma'am, it's okay. Elderly subpopulation, majority
She's a
of
little nervous.
No nervous. I have a coronavirus. That's why some symptoms inside the body. Right?
Okay.
Yeah.
Sir, 2 days ago, Meena got PhD from Delhi University.
Thanks, sir. Yeah.
Anyway, congratulations.
Thank you so much, sir.
Please
Thank
carry
you. Elderly subpopulation, majority of qualified mental health professionals reside in urban India, and 80% of the elderly reside in rural India, which place them at access disadvantage. There is a practical indication suggestion to a decrease in the quality of life due to deterioration of mental health. India must act urgently to strengthen healthcare delivery system in a current multi-province approach. Yeah, now I finish over. Don't take more time.
Yeah, okay.
Yeah, thank you.
Should I
all right.
name the
I
next
think
presenter? Yeah, sir.
Yeah, ma'am. Dr. Hari Krishnan, Mr. Hari Krishnan.
Sir,
Can
we
you get
have
Hari
one
Krishnan
more
also in the
presenter
queue?
in this session only. Should I name?
Okay, but Hari Krishnan, yeah, only one, but Hari Krishnan is also willing to, probably is waiting
Yes, but
from the
he
last
is in
session.
hospital. I think he is having some network issue. So Hari Krishnan, if you want, you can present, but yeah, I am making you co-host. But if today you are in hospital, you wrote,
Yeah, Hari
so
Krishnan is
if
here.
problem, no issue. Hari Krishnan?
He says he's here. Yeah, okay.
Hello?
Hari Krishnan
Hello,
is here,
can you hear
ma'am.
me?
Yeah.
Hello, can you hear me, sir?
Yes. Yes.
Okay. Okay.
Kindly do it in 5 minutes. There's not much time. Already 4:55. Yeah.
Sure, sir, sure, sir. Sure, sir. Is my screen is visible?
Yes, yes.
Yeah, screen is visible, but yes. I think the technical problem, you
Hello,
have to
sir.
speak.
Hello, sir. Can you
Yeah,
hear me?
you have to speak. Yeah, please. Yeah, we can hear you. Please carry on.
Okay, sir. Can you, sir, can you,
Yeah, we
see my
can see the
screen?
screen. Yes.
Okay, sir.
Yes.
Okay, sir. Okay, sir. Topic of my presentation is interpretation of human rights laws in the post-truth world, sir. And the objectives of my study is to
All right.
analyze human rights laws from the perspective of. Hello, sir. Hello.
Yeah, carry on.
Yes.
Please carry on. Yeah, carry on.
Sure, sir. The objectives of my study is to analyze human rights laws from the perspective of post-truth political ideas. The second objective is to find out the misinterpreting the cases of the human rights laws. And the third objective is to study the restrictions of human rights laws with the perspective of national security. And the methodology I adopted is the qualitative data analysis, data collected from the secondary sources. And in the introduction section, the human rights laws are the fundamental and the inalienable right to the human being. And unlike the other laws, it doesn't grant it to any state. And the roots of human rights laws come from the dynamics of life aspects of human. And the Magna Carta, Rights of Bill, French Revolution, American War of Independence, Russian Revolution are the important things in the history of human rights. And the Declaration of Human Rights of Citizens were the important document regarding the human rights. And in the post-truth political scenario, the real-life situation got less important and the emotions are dominating. So the feelings like nationalism and the other factors can easily use and manipulated the people that leads to violate the human rights. So here I am analyzing some cases with this scenario. Actually, in the Indian context, sir. Actually, in the Indian context, to protecting human rights is the one of the original goal of the Constitution. And in the Part 3 of the Constitution is the
Network problem.
Sorry, in 1992, with this protecting aspect, Constitution is also hold the human rights. Actually, with the national emergency, with regarding Article 352 and the suspension of the human rights are the example of this. And in the human rights violation, as I mentioned about that, the state can use the emotional things like nationalism, security to obstruct the human rights. Nation tries to maintain their power as well as the humans protest for their rights. So the human rights violation can possible when the state overthrown the rights of the citizens. The major incidents are the UAPA. UAPA is the Unlawful Activities Prevention Act, aims to prevention of lawful activities, but it can be misused by the state. In recent, India dismisses UN human rights officers concerned about the Kuraj Parvez arrest use of UAPA. Kerala journalist Siddhi Captain also charged under the UAPA and under the CAA 2019 and the NRC are the law for the citizenship, and and actually it is based on the religion, and it is the direct violation of Article 14. But the government used the card of national security in the scenario, so might be used the part of the Islamophobia. In the revocation of 370 is also
Hare
based on the
Krishna,
national security. Yes,
can we
sir.
can we have your conclusion? Can
Sure,
you have
sir,
your
sure, sir.
conclusion of the paper?
Sure, sir. So within 1 minute, sir, I'm going. And actually, with the national security and the civil liberties of the Jammu people is also destroyed, and the state also limited their communication facilities. Now, in this scenario, the violation of human rights like the arbitrary arrest and the detention, freedom of expression and assembly, unfair trials, unlawful attacks and killings, and force and impunity, and the right to health and livelihood, and the right to privacy is also limited. I'm going to the conclusion part. Sir, actually, human rights are inevitable for the development, and but
Yeah. Hare Krishna, I think you have a network problem. We have gone through your conclusion of the paper. I think you are pointing out to an important issue where human rights have to be the concern for human rights will have to be integrated into any kind of a policy framework. I understand your connectivity. You are probably in the hospital, so there are difficulties. But nonetheless, we appreciate your concern and also your contribution to this seminar. Thank you very much.
Backwardness was constructed by state in ways that excluded religious minorities. The political safeguards were underlined by the need to compensate for past discrimination rather than addressing deprivations arising out of the present conditions of the discrimination. The foundation of preferential treatment was revised towards the amelioration of the backwardness alone. More importantly, discussions on reserved quotas in the public services, the status which was declared the designate eligibility of a group for preferential treatment was that of backwardness and not minority status per se. In later stages of discussion, the term minority was withdrawn altogether from constitutional sessions dealing with political safeguards. And in the 3 years of constitutional making, provisions for minorities were amended several times, but the word minority could not find a concise definition. Though there are 3 articles like Article 29, 30, 350A of the Constitution, which were employed, which actually sort of mentioned the word minority, but they no way define what the minority word constitutes of. One can presume maybe from these articles that term refers to linguistic and religious minorities. However, it is left to the discretion of central government to decide what the minority constitutes of. So coming to the conclusion, so while we evaluate the policies of Government of India, one cannot dismiss the reality that they have played a noteworthy role in improving the conditions of underprivileged sections. However, these policies do not spread evenly or do not evenly address discriminations of all the disadvantaged communities of India. The size of the group should not be the concern of the policymakers, because members per se merely describe the proportion of the group in population, not its socio-economic status. A more relevant understanding of minority status should embrace sections of the people who, on consideration of their non-dominant status in the country as whole and because of their language, religion, gender, or caste, are victims of discrimination and therefore deserve to be recipients of affirmative actions of India. Thank you. That's all.
Thank you. Thank you very much, Dr. Raymond. Can you just say a few words, please, on the paper?
Sir, I think there is some problem in your network.
My network?
Now we can hear you.
Yeah, Dr. Raymond, can you kindly speak a few words on the paper, please?
Okay, yeah, sure.
Anyway,
yes.
Yeah.
Okay, I am audible, visible to you all?
Yeah, yes.
Okay. Okay, I think that the paper that I think, if I pronounce your name correctly, Haida.
Umul Bani Haider, sir.
Bani Haida. So I think that the paper that you have co-authored with, with your colleague, right?
Yes, sir. With my co-author, Asma Zainab, is
related to the social justice. Social justice in India. Instead of giving my comment, but instead, if you don't mind, I just have a question I would like to ask.
Yes, sir.
So
Sure, sir.
If I can ask, so why in this paper that your focus of attention is on the religious minorities?
Yes.
Particular?
Yes, sir.
Yeah. So why focusing a particular attention in the religious minorities, and I'm just curious about and why?
Yeah,
why?
maybe, yeah. That is actually the right curiosity. Actually, when I actually started writing this paper, actually just as I saw the advertisement for this conference, like looking at the current scenario in the country, I thought maybe this is the right thing to go with, because as in the first session, Anju Gupta ma'am pointed out, like this is the high time that we need the social inclusion framework for the minorities, like giving the situation we are in right now. So that's what hit me, what struck me, and I thought maybe religious minorities could be the right thing to deal with. So yeah.
Sure,
Yeah,
yeah.
Umul, if you're talking of, Raymond, we will go on to the next speaker. But just before we go to the next speaker, I just want to ask Umul, that
Yes,
when
sir.
you talk of religious minorities, I mean, do you see them in common with the other minorities in general, or you think the religious minority will have to be a special category?
No, sir. I wouldn't say that they are to be dealt like a special category. But as I said earlier, like given the situation in the country right now, I gave the special focus on the religious minorities because of the current situation in the country, and for none other the reason.
No problem, no problem. Thank you very much. Thank you very much.
Thank you.
I think
Thank
we'll
you
go
for
on
answering
to
my
the next
question.
speaker.
Thank you.
Mr. Rojarani, Miss Rojarani, can you please begin your presentation? Then we'll hear Raymond telling us about something about his own experience on the issue. Rojarani, please. Ma'am, you have 5 minutes. Even less than that. Rojarani, can you hear us?
Audible?
Yeah, you are audible, ma'am, but your network problem is there. Please begin.
Yeah. Thank you, sir. Thank you so much for giving this opportunity. Sorry to trouble you, sir. Then my topic is right to health with special reference to tribals. A case study on Vishaka agency area, sir. This place actually it is located in Andhra Pradesh area. The most of the 499 sub-tribes are there, sir. Why I selected this topic is that initially I did the research on right to healthcare system in India. After that, why not I stick on to my own research area? So that's why I chose this topic, sir. Here, if you see that the tribal community in India has the most vulnerable community, as we all know. It is an unequal and dominating and exploiting reading society. But our Indian constitution also is giving a specific chapter to the tribals according to the Article 352 of our Indian constitution. Clearly explain about the what is the tribe. But if you see the population of the tribal is the 8.6% entire the tribal population. But coming to the in Vishaka agency and coming to the Andhra Pradesh area, we have only the 6 lakh population of tribal. But we are facing very vulnerability in the area of Vishaka agency. You all know Visakhapatnam is the tourism place, but still we are in a very backward in a position. If you observe the essential characteristics of the tribals, when we can say it is a tribe, economically backward, then distinct culture and the geographical isolation, we can consider as a tribe, sir. According to the Sustainable Development Goals in 2015 by United Nations General Assembly and intended to achieve the year by 2030 is one of the most important goal according to the 2015 United Nations General Assembly, good health and well-being. Sir, if you observe the Article 21 is saying that right to life. Right to life includes that right to health. But here, when you observe that tribal, non-tribal people, the population of the tribal, we are in a very vulnerable in stage, but non-tribal also at the same time we are facing same issue. But when you compare to the tribe and non-tribe, tribals are very, very backward in nature. They are always depending on the traditional method of healing. Okay, so they is to depending on medicinal plants. They are not ready to accept. They are not ready to digest the generic medicine to take. Even if the pregnant women are, let us take consider the women. Women also is doing so much of hard work. But lack of nutrition is there, lack of vulnerability is there, lack of health diseases. Even in the pregnancy time also, post-pregnancy and the pre-pregnancy time, the woman is facing so many issues. Why? Because the lack of resources, we are facing it. But if you observe, our constitution is giving the specifically article 14, 15, 16, these so many articles are there, so many policies we adopted, but still we are in a drawback. The major problems in the tribal areas, we are facing lack of infrastructural facility, malnutrition, child mortality and malaria, TB, leprosy. These are the few of the problems, but majorly these are the major problems. Few of them I'm quoting because of the lack of time. But in case of Vishaka, already I told you the 6 lakh population is there, one of the biggest tribal region in Andhra Pradesh area. But in that particular area, major we are facing is that unhygienic surroundings, shortage of drugs. Even if we are ready to produce the drugs to the particular tribal people, but they are not ready to accept. When we approach the tribal people during the COVID pandemic scenario, the tribals are literally, they are throwing away from us. Why? Because they are totally depending on the plant depending medicines. Okay, so here when again it considered thousands of villages are there in and around the Andhra Pradesh area, the tribal villages, but there is no proper drinking water facility, lack of access to the drinking water facility, no transportation facility. Because of that reason, the woman who is facing maternity related issues, the woman death rate is more because of the lack of transport facility. If you observe so on, lack of data and monitoring system will not be there. So many injuries will happen when they are reaching to their day-to-day food also. But here, if you observe that the poor quality and inappropriate healthcare measures, low funding, the government also is giving low funding. If you observe overall the healthcare system, we are giving only 4% of our GDP. What about the tribals? Tribals are very, very in a backward in nature. So we are giving only 0.1% of fund we are giving to the tribals. In coming to the Andhra Pradesh, we are giving only 0.1% of income we are giving to the tribals. So these are the major issues. But if you see the hospital facility during that particular locality, Araku and Parderu, Araku is the very tourism place in Andhra area. But 2 hospitals we are depending on. But remaining the hospitals, there is no, even primary healthcare centers are there, but there is no doctors, there is no nurses. But illiterate women, they are ready to treat the pregnant woman when the delivery will happen. The illiterate woman only is doing the delivery. Why? Because lack of doctors in that particular area. But common diseases in Vishaka agency, non-communal diseases, mental health diseases, malnutrition diseases, and then animal attacks also will be there. These are the common diseases are located in the Vishaka agency. Okay, sir. So the commonly communicable diseases, if you see the percentage according to the census, the malaria 30% of percentage is there. 4.5% of the people are suffering. Leprosy, 18.5 people are suffering. But one wonderful thing is that 0% of cancer rate. When you observe to the tribes and non-tribes, non-tribal people are suffering. At 40% of general people are suffering the cancer, but the tribals, they are not suffering at all. 0% cancer rate will be there. But apart from that, communicable diseases are way more. Okay, then here the non-communicable diseases, again diabetic and malnutrition, then pregnancy related problems. Pregnancy related problems, again the traditional medicines they are following, but they are not ready to digest the generic medicine to take. They are not ready to approach the city hospitals. Why? Because lack of community. After observing all the problems, I make out one research problem relating to the why tribal people are suffering inequality in health and healthcare compared to the others. When we can bridge the gap, when how can this gap will be bridged rapidly? So here the socio-economic status, if you observe, mainly agriculture are collectors of the forest producers, hunters. Sir, your mic is, can you please?
Sir, please unmute yourself.
Yeah. Can you have the conclusion, please?
Yes, sir.
Without the conclusion of the paper, ma'am. Yeah.
Yes, sir. Thank you, sir. So I put so many things, the government status among the tribal population, then how the governance mechanism will work. So many policies we adopted, but the main goal we have to reach, not only in the Vishaka agency, entire the tribal community, entire the tribal community. The main goal is to improve the health status of the tribal community, then improve the service coverages, accessibility and acceptability, then proper drinking water facility. Okay, so then awareness about the family planning, the basic laboratory services, then school healthy programs, all these things we need to improve in the thing. But new scheme we adopted recently, the mobile unit consistency in Andhra area. So the vehicles is fitted with all necessary equipment, including microscope and mini labs also. So here the humble request on behalf of me is that the government should take an initiative step regarding to the tribals. They need to provide the proper healthcare facility. Why? Because their rights are violating, not only human rights, not only fundamental rights, both the rights are violating. Thank you, sir.
Thank you very much. I think the paper was very interesting. It had a lot of data to present and also a lot of issues to discuss. But then, given the fact that the time is limited, we are not able to go into full discussion. But nonetheless, we appreciate your paper that you are focused on the dimension of Indian population, which is diverse in nature, and that is the tribals. Thank you very much. I think I will request my co-chair, Dr. Raymond, to speak for 3 minutes, and then we will conclude the session.
Here I want to say one thing, that Raymond has written a wonderful abstract. I think we all are eager to hear your presentation, your paper. Yeah.
Dr. Raymond? Bangladesh must be having good connections of internet.
Okay, hello.
Yes.
Yeah. Please
can you guys see me and see me?
Yeah.
Okay. So once again, thank you for giving me this opportunity, to co-chairing this section. I think I have benefit a lot today by listening to some of the very insightful and analysis the papers being given by our distinguished presenters in this panel. Honestly, I am actually quite a newcomer to this area. I mean, I'm not an expert in the area of health, security in particular, but definitely again through listening again to the paper presentation, I have benefited a lot from you guys, and definitely again in this context, this ongoing COVID-19 pandemic. I think definitely this COVID-19 pandemic has somewhat become a matter of say it's a global public health security. It's a concern for each and every one of us, and so definitely I have greatly benefit from those insightful analysis coming from paper presenters, and definitely again for our paper presenters, I look forward to if possible, I look forward to reading their papers, especially after listening to their presentation. Is it possible, like if I can ask, will I be able to get access to those papers following the conclusion of the conference? I will look forward. I will look forward to reading those papers if possible.
Yes,
Yeah,
actually,
anyway.
we have planned to publish it, but now only we have abstracts because the presenters are demanding more time to submit their full paper. Yeah.
Okay, thank you for that. Thank you for letting me know.
And also, you have submitted a wonderful abstracts. When you will present that?
Yeah, but I can't find the time slot. I can't find the time slot.
No, actually, what I did, like I asked every chairperson and co-chairperson to present their paper in the slot they have given for chairing, because according to your specialization only we have divided your panels.
Oh, right. Yeah, because as far as you can see, I can't see the time slot being assigned to me, so I didn't expect I have to do my paper presentation. Although, like I said, I have actually submit the abstract to you. But my assumption is probably the schedule is just too packed, and so probably can't squeeze me in. But anyway, I'm not sure. Maybe if time permits, definitely I can. I'm happy to do my paper presentation. But maybe is it possible for me to do this, say, in another panel?
Yeah, sure. I will contact to you.
Okay.
After the session, and you can say when you want to present. Then we will add your paper that session only. Yeah.
Okay. Thank you very much for your arrangement. We will talk after.
Yes.
Yeah,
Sure.
Thank you. Yeah, I mean, this is pretty much I would like to say, because I don't want to take too much of the time. Yeah, but thank you for this. Thanks for this.
All right. Thank you so much, Raymond. I think we would have listened to you. I also was looking forward to your views on your sort of mixed experiences that you have had so far, spanning over 3 countries and probably 1 continent, but 2 diverse political systems. You come from Hong Kong. Neighbors, but you come from Hong Kong, which is a different kind of a political system. We also have in Asia, when you are working in Bangladesh and staying in South Asia, although it's in the same continent, it's slightly geographically maybe it's common, but politically different. So I was thinking that you probably would be able to sort of reflect on your experiences of the kind of policy measures which have been undertaken by the governments so far. You have already completed 6 months in Bangladesh. You probably must be an expert in Bangladesh policy matters to a great extent. But nonetheless, I think when you speak, it will be nice for me to also to listen to you. And you are a friend, new friend to South Asia, although you have written about the region before. But nonetheless, I think it'll be good. It was good to have you as a co-chair and also to hear your whatever short views on the various papers. And as far as the paper presenters are concerned, I can tell from my side that not only enough efforts had gone into their writing their papers and also presenting their papers here within the short time limit, and that shows how the enthusiasm is very much there in the so-called young intellectual minds of our country, who still have a lot of hopes and energies left to take India forward and to take the world forward with their own ideas. And I'm very happy that they could also reflect upon the papers from various dimensions. And these papers really kind of a little bit of opening for us, that we know that that how the hopes would have to be nurtured rather than what we think of despair. I think when we talk of new normal in the context of the post-COVID-19 situation, I think instead of describing the new normal as a kind of a situation of despair, we should talk about it as a situation of hope for taking the human society forward. I think diseases have been coming, and I'm told that COVID-19 also, like SARS-2, is going to stay forever with us, maybe as a companion, in my own words. So if that is so, then we have to not give up hope and try to live in a situation of hope. I think these papers which have been presented here, if they could really go in for some kind of a policing of the ideas, in focusing on the various points where our policy intervention should be very much there, it would help us to go a long way in enriching our own generation, also probably the future generation that is soon following us. With these few words, I thank the paper presenters profoundly from the core of my heart. I also thank Dr. Nandini, who has been quite academically active than us by being located in a great university, and also for her leadership to bring all of us together. I saw the other chairman who was there, Dr. Biswas, and I could also hear a few ideas which have been talked about there, and that is really great. And I can also see that Nandini's activities also do mark hope rather than the opposite of it, which is despair. I thank Nandini for doing it. I look forward to Nandini doing many more events like this in the interest, within quote, in the interest of the humanity, and obviously in the interest of the knowledge society. I thank the MIT University for having given a very, very great platform to Dr. Nandini, and also to bring all of us together under one common platform to share our own ideas. With these few words, I thank you. I thank every one of you, and look forward to your involvement in such academic events in the future too. Thank you. Namaskar. Jai Hind.
Thank you, Biswajit sir and Professor Dr. Raymond Lau for chairing and co-chairing this session and managing this session wonderfully. Just I want to recall one thing. In November 2020, we are organizing one conference on human security and pandemic. Dr. Biswajit was chairing the first session, and after I think 20-25 presentations, he remarked that I found no good paper in this session, but okay, kind of that. Recording is available in YouTube. No, this kind of, not in this sense, but what is the opinion of you? Like, no paper was so much worthy, but I am very happy that in this session you found many papers worthy of publishing and worthy of discussion. So I hope, what I mentioned in my inaugural speech also, that people are becoming more and more interested in human security, and they are doing research on human security, and this outcome we can see in the paper presentations also. If you see the quality of the paper and their thinking, how it reflecting in the papers or title, even if you read, now people are, I think, more and more thinking about these issues, and I think this kind of conference is important for that, because we push people to think about human security. So anyways, we are already
Dr. Nandini, just 1 minute. I don't think I didn't comment that it was not worthy paper. I think
no, I am maybe wrongly quoting you, But what I remember, like after said, like you said, like all are early career researchers, and I will share with you the video. I'm having it. So,
Yeah, please do.
No,
Please
see,
do.
this is a very positive comment. Don't take it otherwise. What I want to say to everyone, that Professor Biswajit is very critical, and what I was like expecting, like what he will say at the end of the session. I was expecting for that, and I'm really happy that he found this session a very good one, and you are getting some good inputs of research on the session. So that's, I think, one kind of positive thing. So don't take it otherwise.
No, it's all right. But I am always appreciative of your efforts that you put in for the work, and that we are all stand by you. After all, when each one of us survives, the human society survives.
That whenever I do something, this kind of creative work, I always welcome you and invite you, because I know that whatever you are saying to the researchers, because you are very good academician, so we need you, like people who can criticize, who can praise, who can give some new directions, who can guide us to get some new inputs, whatever on we are working. So that's why this kind of, like, you are not chairing the session just for sake of chairing. You are chairing the session to give some good input to the researchers, because we may, like, you can see many of them are early career researchers. So we need this kind of good professor who can guide us after our presentation. So thank you, sir, for that.